Welcome to Medically Speaking. Our guest today is Dr. John Patti, a hospitalist with Kaleida Health. Doc, thanks for joining us today.
Hi, how are you?
So if you can, let's start by a little bit about your background. Obviously a physician, but what is a hospitalist and how you got there? Give us a little bit about your background here in Western New York as a physician.
Sure. So I was born and raised in Western New York, and I went to University of Buffalo Medical School. From there, my training was in internal medicine and pediatrics. When I first got out of training, I worked in primary care for about 7, 8 years before I made the move to hospitalist medicine. And I'm currently board certified in internal medicine, and I'm a hospitalist with Kaleida Health, and I have been for the past 15 years.
So the term hospitalist, relatively new for viewers who may be watching. They're familiar with primary care doc and cardiologists and things like that. But if you can explain, what is a hospitalist and what role does it play within a health system?
So a hospitalist is a medical specialty that's been developed to care for patients exclusively in the hospital. So we take care of patients from the second they come in the door till they're discharged and all the time in between.
So if you go back 20, 30 years, a patient's own primary care doc would be the ones who would be rounding on them and visiting with them. And is the hospitalist role kind of replaced that?
Exactly. So, 20, 25 years ago, if you were admitted to the hospital, your doctor would come in, see you early in the morning, and then he'd go to his office and see patients all day. And then he wouldn't be able to come back for another 24 hours. Now we have experts in acute medicine in the hospital 24 hours a day, caring for patients throughout the day and throughout their whole hospitalization. And this has really become the standard of care in Western New York.
And so if you can, when you talk about the Western New York, system, the health system at large, how has the hospitalist role grown? How has it evolved? Is this something that most hospitals are doing across Western New York?
That's right. Most of the hospitals have dedicated hospitalists on site. I think that the 24-hour, 7-day a week model to care for patients in real time has had a real positive impact on patient care, because we can evaluate patients if they have condition changes. We can review tests immediately. We're available throughout the day for any kind of discussions with the family. I really think that this has led to a more efficient and certainly a safer model for patient care.
So you talk about the impact on patient care. You talk about the immediacy of being there, the ability for interventions, but what does it do for things like a patient visit or length of stay or, continuity of care? How does it impact patient care in that sense?
Well, certainly from a length of stay standpoint, nobody wants to be in the hospital any longer than they need to be. And if you think back to the old model, you'd be seen once in the morning and then you wouldn't be seen again till the next day. So with having us there, all day, if a test result comes back at 11 o'clock in the morning and it's negative and we have no reason for you to stay in the hospital, we can immediately discharge you back home. So length of stay impact has been huge. I think the biggest thing is families too, communication, because families aren't there at 6 o'clock in the morning. So when the families arrive at the hospital to visit, at 1 o'clock or 4 o'clock or whatever time it is, and they want to speak to the provider caring for them, we're there. So I think the communication has been much better, and both the family and the patients understand more details about the plan and details surrounding their illness.
So if it's a newer way of care, last 10, 15 years, the growth of it, obviously there's a lot of upside and positives, but what are some of the misconceptions that people may have about, the hospitalist or hospitalist programs?
I think the biggest misconception is that your primary doctor doesn't know what's going on while you're in the hospital. We've worked really hard to form partnerships with the primary physicians in the area to make sure that we have continuous communication throughout the hospitalization and most importantly on discharge, so then we can ensure a seamless transition back to the outpatient care of your primary doctor.
So talk a little bit about your team, and I know you guys are at Buffalo General and Suburban. What are you most proud about the team aspect, and what you guys are accomplishing, or what you're doing to help enhance care?
Recently we developed a team management approach to patient care. Our new bedside rounds include multiple people involved in the patient care on a daily basis, such as the nurse, social worker, therapist, and most importantly, the family. This has really had a great impact and has improved communication. And it's also improved quality and made the patient experience more pleasant and safer.
So in terms of moving forward, what's the future of hospitalist medicine? What are trends are happening across the country that maybe we may see here in Western New York? Are there changes coming, or we just continue to see the growth and evolution of the current model?
I think we're constantly changing our current model. Um, this bedside round model that we developed was established by having a committee of people involved on both sides, the hospitalist team, the nurses, administration, everyone involved, to kind of review how we do our patient rounds and see what we can do to improve it. And I think since we started, we've made multiple changes, and I would say more like tweaks along the way to try to improve care. I can't think of any major changes upcoming, but we're constantly improving. When we first started this, we only had one person at night to cover all of our patients, and now we have six. So, one of the big things that we notice is that more providers and fewer patients leads to more quality. And that's one of the biggest things that I see coming down the line, is that we're going to have fewer and fewer patients for each provider.
That's Dr. John Patti, a hospitalist with Kaleida Health, talking about the future of medicine and hospitalist care. Doc, thanks for joining us today.
Thank you.